see reduction in number, okay? Destruction, or market reduction. Oh, there's a word here, market reduction, making it very low. Okay, disinfection. So something that destroys most things. Okay? Sanitization, that means making some place or a food, whatever, okay, so that it did not transfer bacteria or viruses to us. Okay, so to a level, you see, in a surface or also in foods, doesn't right, but it's also for foods. Okay? To an acceptable level for public health purposes. Sterilization, if we call it sterilization, means kill everything, also spores, whatever. So I'm going to give some idea about how we can do this also. Pasteurization, we mostly use it for milk, but it's not just for milk, it's not just for milk. So for many foods we can do this. Okay? So you see, you put it in hot water, okay, or steam, more than 65, something between 65 and 100, we do this. We don't kill everything, but we do something that's, okay, that the number is quite reduced, okay? The non-sporing ones are gone. This, for example, is made for milk because the milk itself may contain tuberculosis, okay? Tuberculosis bovis, for example. So we do this. So what I'm telling, please know that there is no ideal. Okay? Please know that there is no ideal. But there's something close to ideal. What I mean with ideal disinfectant, you see, lethal to microorganisms in high dilution. That means even though we dilute it, even though the concentration is very low, it should be effective. Okay? It should not give harm to tissues or inanimate substances. That means, for example, if you try to disinfect a device, medical device, it should not damage that device. Okay? Inexpensive, for sure, I don't have to tell it. Stable, non-staining, odorless. It should be stable. Stable here means, if you put it there, it should stay there for a while with the effect. Okay? And it should be rapid acting, even in the presence of foreign proteins, exudates, or fibers. Here, please remember the blood. Okay? Blood spots. So, if there are some proteins or something coming from us, or pews, whatever, the effectiveness of the disinfectant, it decreases. So the ideal one should be acting even in the presence of these proteins or exudates, fibers, whatever. There is nothing as such, but there's something close to that I'm going to tell. What we have in the menu, with the time of the COVID, we are using more and more alcohols. The cologne. Remember last year, once we got the COVID, then we did not have cologne in the markets. Actually, the cologne is 80%, not 70%, but 80%. And I looked at the markets, there are even colognes about 60%. So it was something between 60 to 80%. The good ones are 80%. So it's effective. Actually, the 70% is ideal. Okay. From 60 to 80 is acceptable. That's true. 60 to 80 is acceptable. And it's bactericidal in 1-2 minutes. It's also action against viruses. It also has action against viruses. Okay. That's why we're using it for COVID. This is the ethanol that you have it for drinking, so for social drug we are using, for example, inside this keyboard, we got this ethanol, not methanol. Methanol is the one, wood alcohol. I'm going to tell you about bacteria or viruses, and also concentrations, and also please look at where it's helpful. Okay, what does it kill? The other alcohols, okay, isopropanol, 90% is fine. So these two are not toxic too much, and for small children, for skin surfaces, they're effective, but they don't have an effect on spores. So, if you use choline, it's just alcohol, but in some disinfectants, they combine these things with something else, which I'm going to tell. For example, the aldehydes, whatever. So, in the disinfectant, they combine it with something else with the alcohols, because if you just use the alcohol, it's not effective on spores. So for sterilizing, we got better agents. However, we can use the aerosols, droplets, because it may have, micrometer size droplets. So for the mechanical respirators, for example, we can use alcohols in order to, sanitize it. It's like a vapor. It's like a vapor. We do this, and also I thought that for small children, you can use it as such. So the second group comes with the aldehydes. Actually, with distant learning, you don't know what formaldehyde is. Okay? So once you come to the faculty, you're going to learn the, odor of formaldehyde is very bad in anatomy. Okay? So this is something that kills everything. However, it's now banned even in farms, even for animals, because it's very toxic. It's very toxic. It's used in 37%. So you see, microorganisms, spores, it kills everything. Okay? Kills everything. And you put it inside alcohol, prevent polymerization. That means to make it more stable. Okay? And we can use methanamine. It's already used. Methanamine. This year I'm not going to tell it. So methanamine, we take it orally, and it goes to urine, and it's converted to formaldehyde, and it kills bacteria right there. So it's an urinary antiseptic that will be told you next year. So we don't use formaldehyde, but we can use glutaraldehyde. So I told already that we were mixing alcohols with aldehydes. So some disinfectant solutions have this. Okay? So this is something for instruments, prosthetic materials. Okay? So you see, it can even kill spores, but it takes time. And once you got the glutaraldehyde in this concentration in alkaline solution, there should not be a tissue contact. But there are some, low concentrations that use in disinfectants. Boric acids. These days they are saying that boron things. Okay? Actually, for me, it's something toxic. But we have some disinfectants going that boron. Okay? It can be used for topically in ears. So sometimes they clean the ears for this, some doctors. And some esters, parabens, actually they were used. Actually, this should be a word, not an R. They were used. That's better. They were used. Some drugs have some storage lives. Okay, storage life. That means there's a solution. It's a vial, ampoule, whatever, plasma, whatever. So you should keep it inside, let's say, room temperature for some years, 1 year, 2 years, whatever. So previously they were putting some parabens inside there. However, it's shown that, for example, for methotrexate is an anti-cancer drug, which we shall discuss in this course. It's toxic, I know. And they were putting parabens inside that in order to preserve the solution for some years, for 2 years, whatever. But it's shown that parabens were more toxic than the methotrexate itself. So they found another way, for example, freeze drying, whatever, another way to make it. So they make, in these days as such, they don't keep the drug in solution. They dry it as a salt. And, okay, I know for an intravenous infusion, whatever, we need a solution. But just before injecting it, they mix it with, let's say, serum physiologic at once. Then you prepare the solution thing and you inject it. So in this way, you don't use the paraben there. But some acids we are using, for example, acetic acid vinegar. Actually, it's used in medicine. Also, it's used at home. For example, if you have a salad and if you put it in vinegar, you can clean it. But it's also used in medicine as a topical antimicrobial agent, 1%. Okay? So you see, more percentages can be used. Okay? You see, irrigation of lower urinary tract means, inside the bladder, you inject the acetic acids and take it back. That means in order to clean it for some purposes, it can be done. So some aerobic gram-negative bacteria, pseudomonas, you know the definitions of bacteria from last year. The details will be next year, but you know something about this. So it's effective. Salicylic acid is the aspirin thing. Aspirin thing is acetylsalicylic acid. There is one more acid there. But some other acids can also be used as antifungicides. But these days we have different antifungal agents, so we are not using them so much. If we didn't have the halogens, okay, in our hands, the topic for the disinfectant thing would not be complete. So halogens or halogen-containing compounds are maybe the most important ones here. And two halogens are very important here. One is iodine and the second is chlorine. I'm going to tell chlorine also. These two are very important. Okay. For example, you see 1 over 20,000 iodine yields bacteria spores. You see bacteria 1 minute, spores 15 minutes, actually fast. Tincture of iodine, contribute in Turkish, maybe you feel it, I don't know,